This is Yoda, a middle-aged shepherd mix with total body crusting ulcers and a secondary staph infection. We treated the infection with antibiotics and cleaned and soaked the crusts, which revealed bruising of the skin with erosions and ulcers covering almost the entire body. The most likely cause is a vasculitis, lupus, or drug reaction called erythema multiforme. Due to the severity and type of lesions, ulcers with bruising and possible vasculitis, skin cultures for MRSA and biopsies is the fastest and best way to get the diagnosis. An area of skin is selected for culture, and the pus is cleaned and wiped away without using chemicals which could kill the bacteria and negatively affect the skin culture. A sterile culture swab is used, and the skin is expressed to collect fresh exudate or pus. The sterile swab is inserted into the ulcers so that the deeper tissue and bacteria can be collected. The swab is then placed into a sterile culture tube that has a culture media gel to support the bacteria during transportation to the laboratory. It is important to keep the culture cool, but don't freeze or heat. Skin biopsies are the fastest way to identify one of 5 categories: allergy, infection, cancer, endocrine or hormonal, and autoimmune, such as lupus or cutaneous drug reactions like erythema multiforme. A site is identified and the hair is clipped. We do not want to scrub the lesion so that we do not remove any crusts or potentially diagnostic material. A local anesthetic is used to numb the skin. The skin should remain numb for approximately 12 to 24 hours. A 6mm biopsy punch is used to make circular incisions without damaging the tissue, which would affect the diagnostic quality. Several sites are biopsied, typically 3 to 5, to give the pathologist enough tissue to make the clinical and pathological diagnosis. Forceps are used to grasp the subcutaneous fat and separate the skin. Sometimes the fat needs to be cut with scissors to liberate the skin biopsy sample. The skin is then sutured using absorbable suture, which will dissolve, or surgical staples can be used, which often cause less tension, pulling, and discomfort. The surgical staples would need to be removed in 10 to 14 days. The culture and biopsy samples will be submitted to the laboratory, and results will take approximately 1 to 2 weeks. Our biggest differentials are possible lupus, autoimmune skin disease, or a drug reaction such as erythema multiforme. We also submitted the bacterial cultures for possible multi-drug resistant staph such as MRSA or staph pseudointermedius in dogs. We should have the results back in approximately 7 to 10 days. Check back for the diagnosis and updates.